We talked a lot about, in our meetings, this idea of the bottom line, and a word kept coming up, Arianna, upstream. You talked about upstream so often that I thought we were talking about trout fishing. What do you mean by upstream?
So first of all, I'm so excited that you are here. I'm going to miss our 1 p.m. every Monday afternoon coach calls. But upstream is really what we call prevention. It's really how can we deal with the fact that 75% of healthcare costs and healthcare problems are basically lifestyle-related, stress-related, and things we could prevent. We talk a lot about prevention. It's a buzzword. Let's change it and call it upstream because it hasn't really worked. We only spend 3% of healthcare budgets on going upstream and identifying root causes before they become symptoms.
Dave, jump in because, and I normally don't have to tell you that.
What are you trying to say, Cliff?
I'm trying to say, so, I mean, do you think that we can understand and measure those inputs? Because we're going to be talking a lot about them over the next couple of days.
I don't think we have a choice. I think we have to. We have to develop a feedback loop. So we start to look, when we make an intervention, what happens and how does it hit the bottom line, whether it be of a company or your individual health. We have to visualize ways, the problem with healthcare is if I do something huge today, I'm not going to see the impact till a decade or 2 decades from now. Yeah. That delay factor makes engagement very low. It makes compliance very low. So we need to talk about ways to develop an instantaneous feedback loop.
And someone else is going to pay for it, too.
And I think part of it, though, part of the instantaneous feedback loop is performance. That's why if we look at companies' bottom lines and what companies measure, they measure engagement and performance. They measure attrition. And these are metrics that we can identify and get a feedback on much faster than we can get on healthcare in the long term. And the other thing is right now, mental health is becoming such a crisis. And the fact that if we include mental health in the measurement, 90% of healthcare costs and healthcare problems are lifestyle and stress induced and preventable. And that's why I'm so excited about our mental health panel, because we are going to see the role of technology, the role of social media, the role of games in impacting our sleep, in impacting our negative biases regarding our life and therefore mental health.
Yeah, my friend Bernard Tyson's here, the CEO of Kaiser Permanente, and he talks about the fact that the healthcare system has for too long separated the head from the body, and we're going to be able to help to put that back together. We measure what matters, though, and a lot of times it's only recently that we've even begun to talk about some of these factors.
And I think it's critical now that, the beauty and the reason I'm involved, besides the fact you're a nice person with Fortune Brainstorm Health, is because you have a gathering here of, C-level executives, so the decision makers in the company, where we, on these panels, are just fire starters, right? Our goal is to get the conversations going, so in the hallway, at dinner, and others, you can start to interact. And already, in the last hour, at least a half a dozen people have come up and said their career has been changed, a deal has been done by Fortune Health. Right. And it's exciting to see we all need to work together on this problem. And when you look at the group in the audience and what we could all bring to the table, it's powerful.
It's extraordinary. In fact, you all should look to your left and look to your right because you are this extraordinary group of healthcare leaders, of profoundly insightful change agents, across of your spaces. We're seeing it in social sciences and investors. We've got a lot of top investors in healthcare. We've got policymakers and, of course, healthcare company leaders.
And we're going to be talking a lot about behavior change.
Yeah.
Because a lot of people have almost given up on behavior change. They think it's so hard. As David said, compliance is so low. But we believe there are many ways to change that. Starting with the fact that if you look at our daily habits and if you add micro steps, tiny incremental daily habits, we are our habits and we can change our lives by changing our habits. So we're going to be very pragmatic, very specific, and give you very specific micro steps, both for yourselves, your companies, your employees, and also partnerships. I know that I've never left one of our conferences without some new partners for Thrive Global.
You've never left a chair without a new partnership since I've met you, but that's a whole different... The other big theme is big data. I mean, and I think we now are in an era of collection of big data, analytics of big data, machine learning, AI, et cetera. What do we do with it? What's right, what's not? And it's so exciting that this literally is the beginning, hopefully, of the end of many of the diseases based on big data. It's an exciting time.
Now, we're going to have a lot of conversations about that. We have conversations about AI and big data as we're coming through. How real is this revolution?
It's real. There's no question about it. As we're starting to see its impact now, and I can feel it, I could sense it. Some of you CEOs, and obviously you know who you are, have products that are on the market now using AI to help us interpret x-rays, using AI to figure out when is the optimal time for discharge and who needs extra education before their discharge. All of those are real today, and it's going to grow exponentially.
I think it's going to be amazing when it comes to diagnosis and when it comes to treatments. But also, we should not ignore the human element, because sometimes we're drowning in data and starved for wisdom, and having all these biometrics and all this data about ourselves is fantastic, but we need to also know how to use them. And whether we're getting it through our Apple Watch or whether we're getting it with your Fitbit that you are so obsessed with,
Yeah,
or any
And
wearable.
you forgot to wear it.
No, it's on my left.
Oh, good.
Yeah.
Got it.
Yeah.
Or any wearable. It's incredible, valuable information, but we need to know what to do with it. What are the micro steps we can take to improve outcomes?
And especially as we transition to 5G, all of a sudden, we're going to have this, edge computing that's going to be able to do things that we dreamed of. Well, we're not going to need this in our pocket per se, but we're going to have crazy computing power to put data in context so we can actually use it in a personalized way.
That's part of what many are saying, is that we are on the cusp of so many of these things, the confluence of so many new technologies. So you've got 5G with cloud computing. You've got all of the sort of wearable tech that we have, but coupled with, new insights about, molecular markers and being able to check AFib on your watch, that sort of thing. So they're all kind of coming together at the same time.
Yeah, but the crazy announcement came today is that Burger King's Whopper is going to be an Impossible Burger going forward. Is that crazy?
That is absolutely insane, yeah. So what surprises you? We've got 20 seconds left, Arianna?
What surprises me is that this has been the most incredible year so far of really waking up to the dangers of over-relying on technology without at the same time focusing on what we are calling augmented humanity, without kind of setting boundaries to technology, as well as putting technology and technological metrics in context, as David put it. So finally, we're seeing that data by itself isn't going to save us. We need to collect the data and then change the way we act, the way we behave, if we're going to have real amazing outcomes.
Well, I want to thank my two co-chairs, the two most augmented humans I know. Thank you very much.